Hello, my name is Lee Blander, and I'm here on behalf of the HeartBrothers Foundation, a nonprofit that supports thousands of heart failure patients, transplant patients and their families with accommodations and emotional and financial support. And we're here today to talk about the Delta surge and the importance of booster shots and other ways that we can keep folks safe. We're going to start with Tom Bull, who is a transplant survivor. Tom, you were talking about the bubble defense. Can you kind of let people know what that means and why it's important?
Yeah, sure. I mean, I think at this point in the pandemic, most people are familiar with the bubble concept and surrounding yourself with a nuclear group of people, and that way it minimizes contact tracing. And I guess this kind of expands upon that concept. Whereas you surround yourself with vaccinated people or vaccinated bubbles of people, and thus you create a fence of bubbled, of vaccinated, immunized people around you, which just greater increases your immunity to the Delta variant or any variant of COVID for that matter.
Great. You, Tom, have gotten the booster shot. Tell me what else you do every day to protect yourself from.
I mean, I don't think that it's really changed much in my day-to-day life. What I follow, or early on in the pandemic, one of the doctors said to me to follow the 3 V's, and I've actually expanded upon it to be the 4 V's. The 3 V's are venue, ventilation, vocalization, and the fourth is vaccination. But basically, anytime I go into a public place, I think about those 4 things. What's the venue? Am I in somebody's small house, or am I in a stadium full of people, or a concert venue full of people? What's the ventilation like? Is there air flowing, or is it stagnant? What are people doing? Are we singing and chanting, or are people listening to one performer, read? All those factors come into it. And then of course the vaccination, by surrounding yourself, back to the bubble defense, surrounding yourself by vaccinated people, you can further increases your chances of immunity and lessen your chances of contracting COVID.
Great. All right, let's go to Shayla. Shayla, you are also a transplant survivor, and you have 3-year-old twins. So can you talk to us as a young mom? What are your biggest concerns about exposure, especially now during the surge of the Delta variant?
Sure. I'd say my biggest concern is just managing, their developmental and social needs with their risk. So right now, children under 12 are still unable to get vaccinated. So, we're just trying to make sure that they can still do the things that they should as young children, but still stay safe.
Okay. What do you wish that people knew about your family's risk?
I wish that, that people looked at every family and just really thought that, not one is the same as another. So if you look at our family as an example, I have, vibrant 3-year-old children, and my husband is training for a half marathon. So on the surface, we look like a pretty low risk family, but with the kids unvaccinated and me as a post-transplant patient with a compromised immune system, we are, a high risk.
Okay, very good. Let's jump to Mike Dunn, who is a caregiver. His wife is a recent transplant patient. Mike, tell me, what do you want people to know about getting vaccinated and wearing masks, given that your wife is especially vulnerable to COVID?
What I really would like people to know is wearing a mask is such an easy thing. I truly never understand why it's become a crazy issue in these times. As I think is getting vaccinated, the science is there. There's no reason at this point, in my opinion, not to do it. I would say, kind of sadly, a very good friend of mine lost his dad to a very lonely COVID death because he chose to be an anti-vaxxer and, fight against the science. And I really feel for people who have been through that, because it's such a terrible thing to lose someone to COVID. Just get vaccinated, wear a mask. It's really quite simple.
There you go. Tell us about the precautions your family has to take because of the fact that your wife might be immunosuppressed and has just come off of her transplant.
Sure. Well, I have a 3-year-old daughter as well, and we all wear masks when we're out in public as much as we can. My daughter actually really enjoys wearing a mask, which is kind of nice. She wears one at her daycare. We're really trying to just be as cognizant as possible about, social distancing as we still can. It's it's really hard on a playground for a kiddo to social distance from other kids, but you know, we talk about germs and stuff like that with our daughter, and about avoiding close-up encounters, as well as covering our mouth when we sneeze. So
Right.
really just the vaccines for Tiffany and I, and then the mask for all three of us.
Okay, excellent. Hamid, you are a transplant survivor also. What did your doctor talk to you about the booster shot? What did he want you to do about the booster shot?
I reached out to them even before the booster shot became authorized for patients, and I said, what's going on? There's some question about reduced immunity for immunocompromised personnel. And she said, pretend you have no protection with the 2 shots. And as soon as we have enough science to recommend a 3rd booster shot, we will do that. And as soon as it got authorized, I reached out to them and they made arrangements for me to get the 3rd shot for a local pharmacy.
That's great. What do you do every day to keep yourself safe? What kind of
Well,
precautions do you have to take?
So the first thing is I try to be aware of the people in my immediate circle that I am in contact with, make sure they're vaccinated, and they all are. I mean, I don't know anybody who's not vaccinated unless they're children who don't have authorization to have a vaccine. And then if I go out, I wear a mask. I make sure that if I'm going somewhere, if for a purpose I go in, I do my business, I get out. Try to, without being rude, to stay away from people, maintain some physical separation and distance, and try to be smart about it.
There you go. All right, great. And with show of thumbs up, do you all have your booster shot? Thumbs up. Mike, you
I had
too?
my 2nd shot. I'm not able to get, myself as a caregiver, not able to get the 3rd one, but Tiffany's going to very soon.
Right, of course, right. Yeah, okay, very good. All right, great. Thank you guys. I really appreciate it. And we hope that you at home found that this was helpful. If you want to learn more about the HeartBrothers Foundation and all that they do, please visit heartbrothers.org. Thank you so much. Take care. Bye-bye.